Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Kelly Brogan, and we'll be speaking on the root cause resolution for depression in women. Kelly Brogan, MD, is a Manhattan-based holistic women's health psychiatrist, author of the book A Mind of Your Own, and co-editor of the landmark textbook Integrative Therapies for Depression. She completed her psychiatric training and fellowship at NYU Medical Center after graduating from Cornell University Medical College and has a BS from MIT in Systems Neuroscience. She is board certified in psychiatry, psychosomatic medicine, and integrative holistic medicine, and is specialized in root cause resolution approach to psychiatric syndromes and symptoms. She's on the board of GreenMedInfo, Functional Medicine University, Pathways to Family Wellness, NYS Perinatal Association, and Fisher Wallace, Medical Director for Fearless Parent, and Board Member for Health Freedom Action, and the peer-reviewed index journal Alternative Therapies in Health and Medicine. She is a mother of two. For more information, please visit her website at kellybroganmd.com. Welcome, Dr. Kelly Brogan, to the call. I'm so excited to have you on the podcast today.
It's great to be here. Total pleasure.
So, I'm just really thrilled to have you on Well-Adjusted Mama. We've been, connecting over the past couple of years through the Functional Forum, and I've always enjoyed your message and the wisdom that you have to share when I've seen you speak live. And I'm just really excited for our listeners to learn more about your message and specifically about the book that you just published and is coming out. So I'd love for you to just start off with just sharing with our listeners a little bit about your own personal story of why you chose to become a holistic women's health psychiatrist, because I know it's kind of you're a rare breed in psychiatric medicine. So please share with us how you got down.
Yeah, I mean, you're to be congratulated for even referring to it accurately, because most people are like holistic psychology and women's what? So it's something I've sort of it's a trail I guess I've blazed a little bit. When I was in medical school, I really went to medical school to become a psychiatrist because I worked at a suicide hotline where I went to college at MIT. There were actually, unfortunately, a number of completed suicides every year. And so it was a very intense role that they allowed people to volunteer for. And I was supervised by a psychiatrist, and I just thought, this is incredible. I'm majoring in neuroscience. I have this opportunity to crack the code of human behavior and to help people in their, deepest experiences of suffering in this life. Sign me up. And when I was in medical school, I sort of felt like I lost the thread of a type of feminism I felt really identified with. And so for a while I thought, well, why don't I become an OBGYN? And then, of course, all anyone has to do is spend a month in the life of an OBGYN in America to realize that there's a special type of masochism required to take on that particular position. It was really a horrendous experience. So, and nothing to do with like women's health advocacy the way I thought that it was, of course, right? Anyone who has a gynecologist knows that they are hardly their, health advocates or holistic partners in their life journey. It's just unfortunately not the nature of the job description anymore. But, I then found that, through a mentor that I had in medical school, Catherine Berndorf, I found that there was a burgeoning field called reproductive psychiatry. And I thought, well, this is perfect. This is a marriage between the two worlds. This is focusing on women's mental health and really being a partner to women throughout their life experiences and navigating these potential health crises, right? So I spent many years in my conventional training being just a dyed-in-the-wool psychiatrist, prescribing tons and tons and tons of meds. In fact, my subspecialty fellowship, my expertise was in medicating pregnant and breastfeeding women, believe it or not. That was actually, where I developed my appreciation for the process of informed consent, because to sit down with women and talk to them about the risks and benefits, not always the alternatives, but the risks and benefits of medication treatment, whether it was lithium or Risperdal or Zyprexa or Prozac during gestation and then during breastfeeding. And it really wasn't until I was pregnant myself and having these conversations with women that I began to feel into some intuition. I didn't even know what intuition was at that point, but some sort of sense that, despite all this literature, I don't think I would take one of these medications during pregnancy. I just, something about it feels wrong to me, and I'm not sure what that's about, considering I wrote prescriptions for it every day. But it wasn't until I developed postpartum thyroiditis or autoimmune hypothyroidism postpartum that I chose, for reasons I can't even really explain, to go the naturopathic route in working to heal that rather than take, Synthroid for the rest of my life at ever escalating dosages. So I chose to go that route and actually put what I learned in medical school and, my training was a chronic and unremitting autoimmune disease. I put it into remission within the space of about, 8 to 10 months and then, got myself off of thyroid hormone, natural thyroid hormone about a year later. So I accomplished, a feat of bodily healing that was possible according to my conventional training, bringing my antibodies down from the high 2000s to, within the normal range within the space of a year is not something that is even thought to be possible. So that really was the experiential piece of feeling into a very different set of, skills and a knowledge base that then drove me to sort of question what it was that I had learned, and why was it that I learned these things in my conventional training when there might be opportunities to reverse what might become chronic illnesses in the space of, even a few short months. So that was really my aha experience.
Wow. I mean, that's powerful. Listening to you speak the past couple of years, I actually, didn't even know so much that you had more of that conventional practice in the beginning. What year was was your pregnancy that you kind of started to have that shift? How long ago?
Yeah, that was in 2008, and I was sort of ripe, right, for new information about what I had learned, which is why when a book called Anatomy of an Epidemic by Robert Whitaker, who's an investigative journalist, brilliant man, when that came out in 2010, a friend gave it to me and said, this is interesting. What do you think about this? And what this book did to me, I had to be ready for, right? Because it totally collapsed the house of cards for me. I remember crying on the subway, finishing this book, just feeling, the layers of disillusionment around everything that I had sought to master through my conventional training. And essentially what this book does is it brings to bear very unpopular literature, right? Studies that I had never heard about through my entire, decade of training. And what these studies show is that the medications that we use across the board in psychiatry, but let's, speak specifically about antidepressants, that they actually are likely to be responsible for turning what might be a one episode illness, or event or, let's just call it an episode syndrome, turning that into a disabling condition, right? So the very treatment that we are using for depression, and of course he goes through all of, ADHD, psychosis, mania, he goes through all these categories, that if you look at the literature, not only do they not work the way we think they do, but they actually induce a state of dysfunction that is reflected by the fact that depression is now the number one cause of disability worldwide. And we also have more people, up to 30 million Americans by estimates, on antidepressants than ever before in human history. So, right, shouldn't those be inversely proportionate, that you have more people being treated and less people disabled? Why would they ever co-occur that way? So that's his thesis, and that really opened my eyes to the fact that I wasn't seeing the whole truth. That I was being filtered a certain, select, sort of body of literature through my training that supported this really myth that there is a pill-based cure for depression.
Mm-hmm. Oh my goodness, that's just gave me chills, just to think about that. And, obviously your training was not unique, right? I mean, anybody going through medical school, studying psychiatry is going to have that type of training and experience.
Exactly. And that's the thing. So it really allows you to see that, conventional medical training is being filtered through an industry skewed model, right? That it's a pharmaceutical model. The purpose of medical school is to train you, not even really in diagnosis any further, like the art of the physical exam and how to take a comprehensive history, and many people would argue is really lost. We had 1 hour. I had 1 hour of training in the relevance of nutrition to human health in my entire, medical career. Before I started seeking it out on my own. And so what it really is about is match this diagnosis to this pill. That's what the training is for. And it's not to shoot the messengers, because the doctors who taught me directly certainly, weren't working for Janssen Pharmaceuticals themselves, but it's the entire cultural apparatus, hospital funding, the literature that is published, who's publishing it, what, journals are even, sitting in the hallowed halls of these medical schools. It's a very insidious systemic issue that essentially presents us only one side of the picture in terms of pharmaceutical efficacy and safety, and it in no way is prepared to discuss the intricacies of lifestyle medicine, the relevance of things in the non-pharmaceutical arena in terms of intervention. So it skews the presentation of the medication-based model, and then it also diminishes or really neglects and ignores what is very relevant and increasingly telling in terms of the role of disease reversal through personalized lifestyle medicine. And the other problem is that there's a very famous study that talks about how it takes 17 years for what is reflected in the literature to actually trickle into your doctor's office. And this lag time is responsible for, the fact that, as I said, that modern practice is not reflecting modern science, that we have science to undermine what doctors are doing, including prescribing, cholesterol medications to women. That's already in the literature. All you have to do is go to PubMed.gov to check it out. But for doctors to change their practice is a very, it's like turning a ship around, slow and arduous process, and it really reflects a consensus attachment to a status quo. And so that's much of the medicine that you will be exposed to if you go to a conventional doctor's office is what we call consensus medicine or eminence-based medicine, which means it's just sort of what everyone's doing, but it doesn't actually reflect best scientific practice, and certainly doesn't take into account reasons that practice should be reconsidered based on unpublished literature, for example. So it's a bit of a web, that you can get caught into trying how and where to change the system, but it certainly is in dire need of it.
I've had so many conversations with, more conventional allopathic type doctors in my community, and they're like, I want to see the research on the benefits of chiropractic, for example. And, they're talking about science as being their, highest priority for being able to make a recommendation. And I agree. I feel like science is very important for that, but there is an irony there about what you're saying with, being trained on science, but then how that science can be evolving. And certainly once you're out of school, things are changing and new things have been discovered, and a doctor in practice may not be up to date on that latest research.
Absolutely. I love what you're saying. It's so important because, when I first got started in sort of my interest in alternative medicine, if you want to use that term, although I hate that term, I was deep in the literature, scouring the literature for examples of good quality studies that demonstrated either comparable or superior efficacy for natural interventions relative to pharmaceuticals. And, there's a database, GreenMedInfo.com, where all of these natural, intervention studies are cataloged, and there's, thousands, 25,000 abstracts cataloged there. So the literature does actually exist for many of these natural interventions, from acupuncture to yoga to specific nutraceuticals to, sleep practices. It is there, exercise. But the problem is that the randomized placebo-controlled study needs to die. It's no longer appropriate for what we are learning about the relevance of each individual. So what we sometimes call N of one medicine, N of one meaning your experience as an individual brings to bear so many variables that are not accounted for by a study that lumps you with a bunch of strangers, that we have to abandon it because we cannot assess appropriately for the risks that you would be exposing yourself to as an individual, if you were to take a given pharmaceutical product. And we really can't give you a good answer, even in terms of the efficacy, because we don't know, what role, the placebo effect, for example, might play for you versus another person, and how your specific genetics would account for how you metabolize a medication differently than another person. So that type of science is being largely collapsed by the sheer complexity of the variables that we are trying to bring to bear for these very complicated modern day conditions. So while I have had, I spend a couple hours every single Saturday of my life reading abstracts that I get notified about from PubMed. So while I still am very interested in the basic literature, I really think of it as like a communication tool. Like it's just a way to sort of communicate about concepts that I already intuitively know to be true. But the case is that I see it in my practice every single day. I told you about my personal experience. I don't even care or need to wait for the proper types of studies to demonstrate this level of efficacy, because when you understand the principle of evolutionary mismatch and you understand that, we evolved for 2.5 million years without these, 100 plus autoimmune diseases, what's been going on in the past 100, 150 years that we can revert, in terms of exposures we can revert back to, when you sort of get that concept, you don't even need the quote unquote proof, because the proof is in the experience that the patient has. And we're not talking about years necessarily. I working with patients with psychiatric and behavioral symptoms, it's often a month. It takes a month of, strategic application of lifestyle interventions, namely dietary, for us to turn that ship around that otherwise, could seem almost impossible. These people have been living this way for 3, 4, 5 decades. You wouldn't think that their bodily systems would be quite this resilient, that they could bounce back so quickly. I find that near miraculous. So I certainly am less attached to the data. I've seen way, way, way too deep into how easy it is to find exactly the result you're looking for at the outset of a study design. It's just a communication tool on all sides of the conversation.
Yeah, and Kelly, I love what you're saying too. A lot of what you're mentioning with specifically lifestyle, in my opinion, a lot of it's common sense. And sadly sometimes common sense is not so common. So when you're mentioning someone having symptoms, it would make sense to have a positive, healthy lifestyle, and if you're having areas of your life that are lacking, then making changes there and seeing how your body's going to heal and respond to that, would be, in my mind, the first place to go. And, but
well, it's the first do no harm, right? It's like we abandon that principle,
Right.
If we have a sense that there's a relevance of nutrition and dietary interventions to any chronic illness, which of course there's data for that if you care, the data does exist, that is just to suggest that it's relevant. Shouldn't we be starting with that rather than a medication with 75 plus potential side effects and totally unpredictable, risks and dangers? I mean, it's just, like you said, at a certain point, it's just common sense that we have been, sort of out of touch with.
Yeah. So I just love to spend a little bit of time talking about your brand new book called A Mind of Your Own. You've already told us a little bit about why you decided to write it, but maybe if you'd like to elaborate and then tell us a little bit about what's in the book.
Oh yes, I would love that. So, I have, I had this sort of confluence of factors I've discussed. So I had my own personal experience. I had my deep dive into learning why and how I was, taught about this chemical imbalance myth of mental illness. And then I also learned through my networks, through my, healing journey, about the potential for a different kind of medicine. I also then emerged as one of the only psychiatrists on the planet who put down their prescription pad in favor of safer and potentially, much more effective methods. And so I became flooded, really from people on every continent seeking this type of help, because there is a growing sense that the model that psychiatry has to offer is largely bankrupt, right? That it overpromises, that it potentially underdelivers most of the time, and that there are dangers embedded in this model that patients are not talked to about, and that, there's a grassroots movement of patients who are, filled with rage about, the harms enacted upon them by the Guild of Psychiatry. And all you have to do is Google antidepressant withdrawal to see what I'm talking about, because, I never talked to a patient when I started them on a medication about the possibility that they might never be able to discontinue this medication, even if they wanted to. That was not something I was trained to say. And of course, this is what patients are finding out 15, 20 years later when they decide that they've found, another type of treatment modality that they want to explore. And they literally are so dependent on this medication that a withdrawal is disabling to the point of being incompatible with their ongoing life. It's eye-opening, to say the least. So, this combination of factors led me to distill everything that I had researched, over about a decade, all of the data I had amassed to deconstruct the myth of the pill-based cure for depression, and then also to offer the very protocol that I use in my practice, which is really not that complicated, but in a specific sequential order. Working with healing the body first can be a very powerful entry point to freeing, your psychospiritual binds, and so that's really my bias. While I work with many different types of healers, and I know that there are many ways to enter. In fact, I just wrote a blog post called The 4 Archetypes of Transformation, which basically talks about, how some people need to begin on the spiritual level. Some people need to begin on the body level. Some people need to, begin on the data level. They first need to read the papers in the science. So everyone has a different sort of, door that they walk through, but I do think it's a prominent majority that can work best with resolving layers of bodily dysfunction before they begin to see what's left psychiatrically in terms of anxiety, depression, sleep dysfunction, brain fog, fatigue, all these things that come under the very, very large umbrella of psychiatric symptoms. So this is intended to be sort of like a one-stop shop. So first to expose, some of the untruths that we have come to believe, largely because of, pharmaceutical advertising. So we're one of 2 countries in the entire world that allows pharmaceutical companies to speak directly to patients through the media and to tell them about their health, right? So this is no small part of why we have shared beliefs about serotonin imbalances as being the underlying chemistry of depression. This is not actually in the literature. This is not validated by science, but we are told these sort of half-baked, science-sounding myths by companies that stand to profit, of course, from your buying into this rhetoric. And so it's like permeated our consciousness. I mean, there are many holistic and integrative practitioners that I work with who still believe that depression is, a chemical imbalance. And it's only because they haven't taken the time, understandably, to look into a literature that suggests that's anything but the truth, that it's much more likely, if anything, a very nonsense that tells us that there's imbalance elsewhere in the body, whether it's hormonal imbalance, whether it's gut level imbalance, whether it's immune system activation, all of which can often come under the umbrella of inflammatory, signaling in the same ways that all the other chronic diseases of modern civilization do, whether it's heart disease or diabetes or autoimmunity or cancer. They're all looking to be related to the same types of imbalance that can be reversed by focusing on these inter-system connections. So the book is really meant to be exciting and empowering. It's not meant to be some, overwhelming, harrowing, expose on how horrible everything is. So it's meant to be sort of a menu for transformation, because while I am interested in helping women to resolve the symptoms that they most want to get gone, I am more interested in looking at health crises as an opportunity for real transformation and for a dramatic change in the conversation about their life. So, we don't always get these opportunities in the packages we want them, right? Because as a society, I don't think we make a tremendous amount of room for suffering, for struggle, and for everything to sort of fall apart in a way that we can't ignore. But the conventional model just wants to get you back to work, right? So, put a Band-Aid over that shard of glass in your foot and get going, or, suppress the symptoms at any cost. And that is absolutely a model that I reject, because I believe that we're put on this planet, to do something, each our own individual purpose. And it's not going to be possible for you to figure out what that is, until you come into alignment with the messages that you're getting from your body and from your relationship to the very many variables in your life that feed you. So, that's really what I'm looking for. So in my practice, once patients are feeling often physically much better, and in ways that they didn't even know they were struggling, like, they start pooping more than once a week, or, they realize that they were, that the racing heart that they had all the time probably wasn't just like part of their nervous personality, or they realize that actually, they are morning people and they never knew they were, these sorts of things. So once that starts to shift, then all sorts of interesting stuff begins to happen, and I call it a second wave, because, this is when my patients look at their husband and say, like, you know what? Thank you for this experience you've offered me so far, but, I'm moving on. Or they adopt a baby, or they move to Europe, or they come out of the closet, or, all of these sorts of major tectonic shifts begin to happen in their life because they are emboldened and empowered, and the agency is put back in their arena that they gave away. They gave it away to industry. They gave it away to their doctors. They gave it away to this belief that when they were struggling, they needed chemical help, and they needed help from the outside in. So my goal is to get them reoriented towards their own agency, and then to get them on their way. Like, I have no interest in having long-term patients. That's absolutely not my model of practice, because otherwise I've just replaced, one dependency with another. And, while I see my approach as more benign, that's not the idea either. So, it's sort of, this is my offering, to sort of bring this very different type of consciousness to each and every person, without having to hang out with me for a couple of hours in Manhattan to talk about it.
Mm-hmm. Kelly, I just love it. I mean, you're just so, just really hear your passion for empowering women, and that's definitely something I share as well. And, it's really cool. I see this in my own office, that I get to see a woman who's making those shifts, right? She's literally doing the work to grow herself through these health changes that you're mentioning, and it does create a ripple effect for the rest of her life. She's not tolerating the job where she's treated like crap, or marriage where she's not, respected, or she's not putting up with that crap anymore. She's like, I want more out of my life, and so I think that's just so exciting to watch that shift in a woman, for sure.
Absolutely. It's what we're here to do. And, that I can get on my soapbox about this idea of, sort of feminine essence and what that means, like how we've lost touch with that, and how so many of us professional women exist in our very masculine energy. We've been molded into a psychology that is culturally dominant right now, and has been, for several thousand years, which, seeks mastery and dominance and all of these very sort of, dualistas, right? Like me versus them, us versus germs, like you versus your body. It's this consciousness that takes us away from being guided towards the collective, being guided towards like unification, with nature, with other women, with community. We live in the most disconnected way since the dawn of human history, from our native sense. And it's no wonder we're struggling. I have a friend, Charles Eisenstein, who writes about how depression is almost the only appropriate reaction to what the hell is going on the planet today. How are we pathologizing this? It's actually a meaningful and important message on an existential level. And of course, I talk a lot about on a bodily level, where the underpinnings of depression actually make sense and why, that inflammatory response is happening. But we are being called, and I think of myself just as an ambassador, we're being called as women to wake up. And part of what we need to wake up to is that we have gotten completely out of touch with our deepest and most infinite power, which doesn't come from planning, fixing, doing, suppressing, managing type of psychology. It comes from getting your mind completely out of the picture and feeling into what your intuition tells you. No one can mess with that. And it reverberates a power that is, it makes, coming from your brain-based intellect seem almost sad, almost like a child having a tantrum, so it's a very exciting thing actually, because, this has been my own personal transformation. And it certainly, came with a lot of challenge and difficulty and suffering. But it's so worth it to get to this place of agency. And there are tons of women the world over who are waking up to this truth. And so I really long for a time, when we feel more connected and that we can rely on each other in a way, that we're just not doing right now. We're just not, sort of feeling into anything but to survive, many of my patients, all they care about is getting back to work and making sure that they're managing their responsibilities. Is that the point of life? Seriously? It's sort of like a death of a salesman kind of, thinking we're just here to go to work, come home, go to work, come home. Or do we need to sort of sometimes really let, all of the, pieces fall before we can understand how we can start over? Because you can start over anytime. You can start over any age, any time. You can wake up tomorrow and do it differently. And I find that really exciting.
It is exciting. And that's, that is the beauty, especially, living in this part of the world, right? In America, we have so much more freedom, and we can make choices. And I know sometimes as women, we feel like we're stuck and we don't have choices, but we always do. And so I think it's important to evaluate, and if you want a different result, you have to make a different choice.
That's right. That's the definition of insanity, right? Doing the same thing over and over again and expecting a different result.
Mm-hmm. So I'd love if you could just spend a little bit of time talking about some of the recommendations for basic lifestyle interventions that can actually help end depression without using medication that you have in your book.
Absolutely. So, it wasn't until I stopped prescribing and I put these interventions that I'll detail into the foreground that I was able to appreciate just how powerful they are and how efficient they are. Meaning, how quickly they can exact change. When you prescribe a medication and then you say, oh, wait, it'd be nice if you ate a little healthier as sort of the window dressing, it just, in my opinion, doesn't work. And I don't know if there's, psychological placebo effect level, elements to that, dilution of the power of the intervention or what, but it just doesn't have the same effect. So it wasn't until I made that radical shift and committed to it that I began to really see, how simple it can be. So, as a context, I have never really had a mentor in this realm, of sort of radically holistic psychiatry, and I'm comfortable, sort of doing things on my own and driven. But I did have the honor and privilege to work with, the now late, Dr. Nicholas Gonzalez, and whom obviously has also been featured on the forum and, around, basically the internet. He never said no to an interview, who was a holistic doctor who practiced in, New York City and treated, primarily terminal cancers, but also a variety of chronic diseases with a nutrition-based protocol that helped me to understand how what I was doing in my practice actually made sense in a broader context. Because, Nick and his, forefathers, including Dr. Weston Price, who was a, dentist who helped us through naturalistic data understand that people are meant to eat very different things. And guess what? With these very different diets, they still are all healthier than, the healthiest American. And he did his work, in the early 1900s, traveling around looking at all of these indigenous people the world over, from the Eskimos to, alpine herders to Amazonians, why they were not suffering from degenerative disease the way that Americans were, and dental decay. And what he found was that there are some simple tenets to the types of diets that they, engaged that we sort of lost touch with. So the template that I use dietarily is informed by all of these people, and their work, and also, my now almost decade of clinical practice applying it, and my own personal experience applying it. It's sort of a clean slate, run-in, where I ask patients to eliminate, some more modern foods and to focus on the sourcing of these more ancestral, foods that are sort of left over. So what it looks like for the first 30 days is a very strict adherence to the relevance of organic, produce, and also this is a meat-inclusive diet, so it is of incredible importance to source consciously the type of meat that you eat, and I actually give recommendations around that, but suffice it to say that the word pastured is one of the only words that has any relevance in this arena of greenwashed, health foods at this point, where people slap the word organic on everything and it barely means anything anymore. So what I ask patients to eat for the first month is basically a diet of red meat, so, pork, beef, lamb, bison, game, fish, poultry, eggs, including the yolks, and then a variety of vegetables with a focus on cruciferous vegetables, so like things like broccoli, Brussels sprouts, cauliflower, and then sort of more minimal fruits, but fruits are certainly permitted, nuts and seeds, and then a focus on oils like coconut oil, clarified butter, which is called ghee, and then, the inclusion liberally of these animal-based fats. What we're taking out is dairy, and it's not because I think no one on the planet is, can be healthy with dairy. I think actually there are many people who can work with raw dairy, but if we're looking to move the needle dramatically, often removing it for a run-in period can be really, it was a massive game changer for me. So obviously I'm biased in that regard, but can be very important. So we're taking dairy out. We're taking all grains out to begin with, although all of my patients on their longer-term diets eat gluten-free grains. So, but in the run-in, we're taking grains out. We're also taking legumes out, so beans, peanuts, and soy are coming out of the diet completely. So, so you're left with quite a lot of food, but obviously it shines a light on how much of those more modern foods and certainly processed and packaged foods you might have been eating, right? Because no matter how much you advocate for, beans, grains, and dairy, for them to be unprocessed and properly prepared is quite a labor, for the most part. And, not many people are doing it that way. But so let's just take them out and see what happens. So that's the primary pillar of the first month. And gluten and dairy are big needle movers, not only because they're almost always processed, but often because they contain proteins that can be very stimulatory to the immune system. And there's a growing and really compelling literature in psychiatry implicating these two foods as being not only very addictive, literally, but also behaviorally modifying. So, we know that casein, the proteins in dairy, particularly cow dairy, when it's metabolized, has direct impact on the brain. through the opiate system and
right, like more
opiate reception. Yeah. So let's just sort of clear that slate. And I also ask patients to begin with 3 minutes of, what is called medical meditation a day. So it's based on Kundalini Yoga, which is, something I feel very, very passionately about because, I followed the medical literature on meditation for many years, never did it, never made time for it, was always too busy, found it really hard and boring to sit there and try and watch my thoughts and, it's uncomfortable for somebody who's wired the way I am, to even try to do that. So of course you're going to avoid it. And Kundalini Yoga is wonderful for people who struggle with basic meditation, mindful meditation, because, it sort of gives you stuff to do during it. So it's, often movements or specific types of breathing. Sometimes that can be pretty complex, breathing in one nostril, out the other, in your mouth, out your mouth, it's like, different patterns, different paces. Sometimes there's mantra included, who is ever sitting at home, like singing to themselves ancient, Gurmukhi, phrases. Obviously it's going to be a really uncomfortable and strange transition, but it actually, I can't tell you how many patients I recommend specific meditations to, and they'll tell me the first time they did it, they started crying. Because it's like almost taps into this very sort of ancient toolkit that we don't use anymore, but our body remembers it, and it's very cool. So I ask people to start just 3 minutes a day because it's critical that we start to send your body a signal of safety from multiple different sides. And meditation, and specifically in my opinion, this type is one of the most powerful ways to send this top-down signal. I mean, until I started, so now I do 45 minutes every single morning, no questions, compromises, excuses, nothing. Every single, if I slept 2 hours the night before, I have transformed my own nervous system in this way because, I went from being somebody who was very high strung and vigilant, could be described as being anxious, but certainly who experienced life as really quite stressful, to having access to a level of joy and calm, and a resiliency around stress that I never thought possible. I just thought this was my personality, and in fact, when you tone your nervous system through this type of a practice, you can literally transform your experience of life so that you can look at it with a degree of curiosity that protects you from almost anything that could be coming down the pike. It's pretty profound. So I'm pretty passionate about that. And then I ask people to do, to start with, if they're not already exercising, to just start with 20 minutes a week, one time a week, of a burst type exercise if they, after the first time doing it, they feel well doing it, because not everyone is ready for this particular layer. And burst type exercise is basically pushing yourself really hard for 30 seconds, whether it's jump roping or on the elliptical or doing, jumping jacks. It can be many different things. And then sort of doing 60% of your effort for 90 seconds. And those, first month interventions are then layered in. There's, sort of the detox component. So, ranging from, simple stuff like skin brushing to, more big gun interventions like coffee enemas, to visiting all of your products, from laundry detergent to cleaning products to cosmetics, and your water and your air. And, that process for most people takes some time, and it's fine if it does, because every time you go to the store, you're making a choice, and it's either going to be, saying yes to your body or saying no. So you learn that, and so this is just sort of a primer in that type of consciousness. But that's very much a work in progress. I mean, all the time I will, find out that a product I thought was clean and safe is actually not. And, I very much consider myself a student of, sort of environmental detox myself. But I also can hook you up with some people for whom this is all they do all day long. And so that's also part of the communication network of expertise. So that's sort of like I guess an overview of it.
Wow. Yeah. Thank God for the EWG, right? That's how I get my information for clean products, because it can be overwhelming as a consumer to know what's really safe and not, because what, to your point, products can be, kind of misleading. It could be labeled natural and really not be natural or safe at all.
Mm-hmm.
It's disturbing.
Very
so
true.
yeah, thank God for Environmental Working Group.
Yeah, I have a friend who runs a website called I Read Labels for You, which is also Irina Webb, who's just also she's quite savvy investigator, and and this is her deal. This is like all she does all day long, and she's very committed to it and devoted, and so it's a collective effort because we have to stay one step ahead of the fact that in the end, this is these are businesses. They're not actually out to take care of us. They're out to, they're beholden to their shareholders. That's the model. So we have to, it's not conspiracy-oriented thinking to reflect on that. That's just the nature of a capitalistic society. So, we have to continuously do our research and continue to learn about the 100,000 some chemicals that are now in our environment that are probably having varying degrees of impact on our immune and hormonal systems and how we can mitigate our exposure. But we also, have to not allow that to engender a sense of hopelessness, right? Like there was a window I went through where I just felt like, well, this all sucks. Like everything is so terminally messed up that why don't we just, throw in the towel? Because I don't even know why I brought 2 kids into this world. This is a disgusting place, and there's no way we're going to clean it up. And what's the point? I really struggled with that for a while, and and then you start to learn about the incredible resilience. I mean, we should basically all be dead, and we're not.
Right.
So the fact that we're not, even though we're very sick, is testament to the incredible resiliency of the body. And really, that's why I love the sort of top-down, effects of meditation, is because when you can change how your body perceives stress, so that when you get worried about, fluoride in your tap water, you don't let it freak you out. You work to empower yourself, so you engender a consciousness that allows you to feel safer when you make an intervention. And then you let it go, right? Mm-hmm. So that process, almost like a ritual, that you bring to all of your exposures in life, is meant to actually leave you with a sense of empowerment. And that's how it can be healing in ways that maybe even the intervention itself isn't even accomplishing. We don't know. So it becomes very almost mystical on some level when you look at our potential to really transform our experience on this quite toxic planet, because I'm living proof, obviously, and I have hundreds of patients who are as well, that you can actually feel quite vital on a planet and in a lifestyle that should really be driving you 6 feet under. So
that's right.
Yeah.
It's amazing how, like you said, resilient the body is, and despite all of the toxicities that we throw at it, how it's able to really adapt in such an amazing way. And I think there's also something to be said about epigenetics too. You mentioned these lifestyle interventions, but let's say you have a patient who comes to your office who's like, well, everybody in my family has some sort of mental illness, and they come in with this belief that they've inherited, depression or mental illness, and that this is their journey. And, you haven't, what would you say to somebody like that who's, thinking that there's this family, inheritance genetic aspect?
Yeah, so I address that in sort of the myth busting I do in this book, because, we have been searching for the depression gene for decades, and every meta-analysis out has unequivocally shown us that there is no such thing. And should that surprise, is there a fever gene? Should that surprise us? There's, depression is a symptom. It is not a heritable disease. And that is true also for schizophrenia, for bipolar disorder, for OCD, for everything as you go down the list. Now, that doesn't mean that there isn't, a vulnerability conferred to environmental and lifestyle exposures that then expresses this phenotype. That doesn't mean that, right? So that's why, we have a mom, a grandma, and a daughter who all wash their hands 45 times an hour. There is a shared confluence of variables, but it has to do only very partially with the vulnerable, like gun loading, let's say, that genes confer. And so the powerful message in that, the power in epigenetics, and the beauty and the gift in it is really that it's the environmental exposures, whether it's, dietary or, pharmaceutical or otherwise, these environmental, exposures pull the trigger. So, if you, inherit genetic loading for celiac disease, but you never have, wheat in your entire life, guess what? You don't have celiac disease. You're doing all right. You're doing just fine with no symptoms of your disease. And so this is, an example we see time and time again. I mean, I've written an article on the BRCA gene that women are, hacking their boobs off and ripping their ovaries out because they feel destined to manifest a pathology that is included in their genes. Well, guess what? We understood with the completion of the Human Genome Project that it just doesn't work that way, that our genes are not the book of life, that it's actually the expression of those genes, and that's what we're calling epigenetics, that determines what goes down on the physiologic level in the body. So we have, every reason to believe that it's within your power to change what you might otherwise have been told or yourself believe is your genetic destiny. So I really, feel passionately about that. And I also looked at the literature that says, sorry, no, it's not heritable. We have no evidence of that fact. Not for a single mental illness. Not a single one. And we would if it were.
Right. Right.
Or like Huntington's disease or something. We would have some sense. But even, I could even take it farther and say that even what we think of as, sort of fait accompli, dominantly herited illnesses like Huntington's disease, that actually there still is room to change your destiny and to mitigate and modify the expression of those genes. That's what science is showing us. So there's really no such thing as a completely, it's Lamarckian genetics. It's within your lifetime you can change your genetic expression. So that's pretty cool.
It's so cool. It's so powerful. That's something that I've been, really wanting to share with, the community that I reach out to, is that you're not destined to have the same, autoimmune diseases or any other type of disease that your family has. And especially for women listening who have not started having a yet, making these lifestyle changes can actually change what you will pass along to your children. So
Absolutely.
I think that's really exciting as well.
Absolutely.
Yeah.
Yes. I mean, that's a critical piece of the sort of forgotten, story about conception, right? Which is that it actually, for many cultures, is a process, that begins months and months and months before two people have even begun to think about, having sex to conceive. And it has to do with allocating specific nutritionally dense foods to these people, reconfiguring their lifestyle so as to begin to support that optimal expression, in the germline. So we have to start thinking this way, now, no matter where you are, but particularly if you're thinking about conceiving, this is like just a gift. God, I wish I had known. It's like that Maya Angelou quote, right? Like, when you know better, you do better. But I wish I had known what I know now before I, became pregnant for the first time. It's, you never want to learn the hard way, but it's also never too late, to intervene, in your lifescape in these ways. So, critical population to hear this message.
Definitely. So I just want to wrap up our interview. Any last thoughts you want to share? And then also, how can women learn more about you and buy your book?
Yeah, so I so much appreciate, having this opportunity and sort of speaking to people receptive, because, this isn't for everyone. And I have no interest in arguing about this and debating about it and being right and coercing anyone. My interest is in offering, what feels so true to me. And if you feel even like a little bit of a yes inside about it, I think that, this will be a helpful sort of menu, and set of tools to begin that, what really is then a lifelong process, right? So, I would love, to bring more and more women to this, level of consciousness, and my interest is for them to do this really on their own and in their own communities. So that's what the book is for. And there is a companion course coming out, in April called Vital Mind Reset. And that is going to just be basically a more, hands-on extension of the book's, message, sort of like, where do I go from the first month type of a thing. And been working on that for some time now, and the launch just sort of happens to magically coincide perfectly with sort of the book coming out in March. So I hope to create, space for a new conversation about this, really critical topic. So thank you for being a part of that.
Mm-hmm. So they can find this information on your website?
Yes, everything is there on Facebook or my website, and it's just kellybroganmd.com.
Great. And then they can go to Amazon or anywhere books are sold to get your book, A Mind of Your Own.
Yes. And I'm actually asking people to think about also supporting local bookstores, just in line with this idea that, corporate conglomerates are, something that we want to keep in balance with other sort of outlets for information and communication. So, this might be a nice time to stop by a local bookstore, if you haven't done so in about a decade as well.
That's awesome. Well, Kelly, this was such a pleasure having you on Well-Adjusted Mama today, and I'm so happy that you were able to take the time to share your passion and wisdom for women's health.
I appreciate the opportunity. Thanks so much.